The next speaker is Allison Ross from Home Care Providers. So Allison, please.
Hello, everybody. I'll tell you a bit about myself. So I'm Allison Ross. I have been a home carer for 21 years now. And the last 18 months has probably been the most stressful, the most anxiety I felt within my job. I've got a wee few bullet points here, so sorry, I'll just read some of these out. So in home care, we are not medically trained, so we don't really understand the science behind COVID, and all the while still having to go in and do the best that we can for our clients, trying to keep them safe, trying to keep ourselves safe. A lot of houses we go into, they're not the most hygienic. So having access to deal with our own personal hygiene after dealing with a client that's maybe had COVID has been very tough. There was a worry for our own health and safety, taking COVID back to our families, taking it into other vulnerable clients. At the very beginning, we were told that we didn't need things like PPE if a client didn't have COVID. PPE was quite tough to get from our employers. That was resolved and it's now not an issue, thankfully. We had to take on extra duties because families were maybe isolating themselves. So we had to do extra tasks like housework, shopping. So there was a lot of extra duties put onto us with no extra pay. We are one of the lowest paid workers, doing a very valuable job. Quite a lot with lack of support from managers, because them as well, they didn't really know what they were dealing with. They were trying to keep a service going with very little staff. The staffing levels right now are at crisis point. I don't think enough recruitment is happening quick enough. Communication has also been quite poor. If a client had tested positive, communication wasn't sort of put down the chain. So sometimes we would get a client that had tested positive and we were unaware of that. So that was quite scary. During the times that the shops and things were closed, we had nowhere to go for toilet facilities. During break times, cafes and things like that were closed. So home carers at times were sitting in closes and in bus stops because there was just nowhere for them to go. And the weather in the winter months, as you know, it's awful. I contracted COVID in March of 2020. And at that point, testing wasn't available. So I had 4 weeks off work. And all the time when I was off and I was unwell, it was in the back of my mind that we were severely short-staffed and clients were needing their carer to go to them. So you had that, the guilt of not being at your work, knowing that your colleagues were in crisis too and taking on extra work. And that's on the carer side. So as a union representative, I had carers calling me, crying, stressed, because if they knew that they were getting a client that was COVID positive, they just didn't have enough information and they were frightened. Even as close as last week, I had a carer talk to me and she had her husband had tested positive, and she was being told that she was still to go to work when the guidelines clearly tell that we should be isolating for 10 days if you're pinged as a close contact. There's so much more I could say, but I realise we've got to wrap up, but thanks for listening to me.
Thank you very much, Alison. I have to say I'm a support worker myself, so I could identify with everything you said. And I think that what happened with social care during the pandemic, it was absolutely unacceptable. I mean, we worked with no guidelines, with no PPE. It was just scary. It was really, really, really scary. So I'm glad that as a union rep, you have taken on these cases. So thank you very much, Alison. Our next speaker is Vicky van der Togt. I hope I have pronounced that properly, from Long COVID and the Zero COVID Alliance. So Vicky first, please.
Hi, thank you so much for having me. I'm Vicky van der Togt. I'm a long COVID patient from the Netherlands. I got COVID in March 2020, and honestly, my disease went pretty much similar as Jane that she just described. But the main difference is I was 28 when I got COVID, and in the Netherlands, my prime minister came out stating that COVID only hit the elderly. Young people didn't have any symptoms, but I wasn't getting any better. And so nobody was talking about this in my country. So I started speaking up in June and connected with other people in other countries who were doing the same thing. So people from Long COVID SOS, for example, from Long COVID Kids. There were, for example, Elisa Perreco from Italy. And so we connected, and the Long COVID advocacy really started from there. And so we were hoping by forming all these groups that we could really put a spotlight on the issue of long COVID. And then in the second half of 2020, the numbers of long COVID, the prevalence numbers started rolling in, mainly because of the Office of National Statistics, who were doing great modeling based on the tracker app that was used in the UK. And we were really hoping, well, these numbers are so high, people must see the problem with this and must be alarmed by this. But sadly, that wasn't the case. Although people were reporting on the actual numbers, the care was still lacking. And actually, because there was so much media attention for it, the overall idea almost was that, oh, it's under control now. We have attention for this problem. But sadly, even with that acknowledgement in the UK in the second half of 2020, there weren't many countries that followed. So to kind of give a broader perspective, because with my organization, the Zero COVID Alliance, we support multiple long COVID support groups. And what we see happening around the world is that although long COVID is acknowledged, there are not guidelines that fit with the amount of information that is already out there. There are only a handful of countries that have acknowledged it, and the care is not even up to standard in those countries. So there's still a lot that needs to happen. So in terms of what is still needed, to kind of go into my own situation, I haven't been able to get care in 1.5 years. And even though I have heart issues, I have neurological symptoms, so it's pretty clear that there's examinations needed. For me and most other patients, because patients are reporting pretty severe symptoms that just need to be looked at. But to give a more broader idea of what is needed, a lot of patients are struggling with their financial situation. In a lot of countries, there is no financial support when you get sick. And so this is really something that I would like to highlight, and that needs to change. But in terms of care, acknowledgement is not all there is to it. We need examinations, we need proper care, we need a multidisciplinary approach to treatment. And first off, we need to be able to get a diagnosis, because even though there is now an option to get diagnosed, a lot of healthcare organizations or a lot of healthcare professionals still don't know how to find that diagnosis, or are not actually diagnosing the patients that come into their offices. So in terms of what I think needs to happen first is make sure that all these healthcare organizations are fully up to date on what long COVID is. There needs to be education for healthcare professionals so that they're able to help the patients that come in with their symptoms. They need to be able to provide reliable information in multiple languages, because it turns out that if you speak English, it's really easy to get the information, but it's not so much in other countries. So what I would like to end with, I only get 4 minutes, is that luckily there is now some information. The WHO has just published their guidelines. It's a flyer. Everyone can print it. Everyone can put it up in their offices to be able to provide patients with some information that they need. But also look at what we all can do. We all know about long COVID now. We can all raise awareness for this topic, because patients really need your help. We need all of your help, because even though we are now in the media, it's clear that we need to all raise our voices to put this topic on the map, put it on the agenda, so that patients actually get the care that goes along with the media attention. So that is what I would like to ask of all of you.
Thank you, Vicky. Thank you very much. It's very important, all the points that you made, and the kind of this constructive approach, suggesting solutions. I think that young people were given a false message of safety about COVID that has affected us all, and it has an impact on all us as a society. So thank you very much, Vicky. I'm gonna give now the turn to speak to from Connell, that is a teacher with us. So Rob, if you're ready.
Absolutely. Thank you to all the speakers so far. Okay, some really insightful stories. Thank you for sharing that. Yeah, I'm Rob Connell. I'm a primary teacher. I'm the EIS union rep in my school, and I'm the teaching lead on our health and safety team. I just want to talk a little bit about what it's been like for teachers, and then even more importantly, what it has been and is like for kids. And teachers are, as you've probably heard, under unprecedented levels of stress. There's been a lot of risk of burnout. There's been tears and some frayed nerves, and I imagine there'll be long-term effects on psychological health and well-being for kids, for teachers as well as kids. But I want to focus on two particular stories of colleagues of mine in my school. That has a 31-year-old colleague who is incredibly fit and active, ran the school running club, peak physical condition. And they suffered the effects of long COVID. They couldn't walk more than for a couple of minutes for months, and they couldn't work for months, and they're still significantly affected 8 months later. Someone who was, in fabulous condition. They were quite lucky with their own doctor and their own head teacher in terms of how it was handled, but they're still bumping up against the fact that structurally our governments and employers, they're not ready for it. They're not prepared literally to deal with long COVID. People tell them, are you just a bit tired? Is it a psychosomatic condition? Things like that. The sick leave policies, return to work and phase return plans, reasonable workplace adjustments. None of the framework is there to set up to deal with long COVID. And that's just the professional impact. Personally, it's been hugely physically and psychologically damaging for that teacher. And they're just one of tens of thousands of people in Scotland that are currently affected by long COVID. Another colleague, this is just in the last week or two, had found herself in very close contact with two other colleagues because they had to deal with a very distressed child. One of those colleagues then tested positive, but the other two colleagues didn't get pinged. And so they were told not to go for a PCR test, told to come into work and work with the other children and the other teachers all day, despite the fact that they knew for a fact that they had been in close contact for several minutes with somebody who definitely had COVID, right? So, and again, this is an incredible situation. To talk about the kids, there's been a lot of media talk about COVID-safe classrooms and social distancing in schools accompanied by pictures of kids sitting at tables well spaced from each other, and it's a complete fiction, right? Every school day, classes have looked like they always have, 30 or more people sitting cheek by jowl all day, and in primary schools with no masks. We're fortunate in my school, we've got decent sized classrooms and windows that open properly, but many others aren't so lucky, and our rooms are barely big enough to accommodate them. poor ventilation. So while we are working very hard to try and keep the spaces clean and do what we can, there's minimal mitigations actually in place. We've got these facts posters up over the school, like every other workplace, face coverings, avoid crowds, clean hands, 2 meter distance, self-isolate if you've been exposed. We can't do 3 of those 5 in high schools and 4 of those 5 in primary schools because there's no masks. So really, we're just washing hands all day. Right? And that's how it is. We're constantly washing hands and wiping desks, and that's to try and combat an airborne virus. Lastly, I'd just like to note that most teachers I speak to are horrified that the effect of current government policy is that children will now be infected in their tens or hundreds of thousands right now, and are being barred from vaccines that the rest of the world have had, and that were cleared as safe for them 3 months ago. The UK, we heard last night, is sending 4 million Pfizer vaccines to Australia before they expire, where they'll use them to vaccinate their young teens, while ours are denied that same protection. And our kids are crowded, they're stressed, exposed, and if they're under 16, they're not allowed to be vaccinated. And that's almost uniquely in countries that have the money and the access to vaccines to do it. Everybody else is doing it from at least 12 up. The studies do vary, but at least 1 in 12 children with COVID are likely to suffer from long COVID. So we're right now infecting tens of thousands of children. That's thousands of long COVID cases. And we don't even know what the long-term impacts, the full long-term impacts of this disease are going to be. So it's a ridiculous situation that we're placing our school children in, and our teachers, but our teachers are pretty much all double vaccinated. And the kids are. I'm going to wrap up there. Thank you for listening.
Thank you very much, Rob, for your speech. I think, like in many ways, like teachers and social care staff and everybody kind of that was asked to work during the pandemic, it's been quite scary and chaotic with kind of change of guidelines, not enough PPE, and I appreciate your speech today with case scenarios and real examples of what's happening in the classrooms. Thank you very much, Rob. Our next speaker is Shally Witcher from COVID Issues. Is going to talk about COVID issues from disabled people. So Shally, please.
Hi everyone. It's good to be here. My name is Sally Witcher. I'm a disabled person, and I am in what was the shielding group. Well, I was eventually, and that's going to be part of what I'm going to tell you about. Also, for the first year, I was the Chief Executive Officer of Inclusion Scotland, which is a national disability organisation, and that is of disabled people rather than for disabled people. It matters because I think, as you'll see, I'm going to say a little bit about my experience in that role, but also as a disabled person myself. So it means that, in effect, the organisations that are of disabled people, we walk the walk, we talk the talk, we wheel the wheel. We know we have the authority to talk about what it's actually like because we live it every day. We also take something which people may or may not know about or care about, but which is very important to us, called the social model. And that says that what disables people is not their impairment. The fact that I'm in a wheelchair doesn't disable me. It's things like other people's attitudes towards us. It's inaccessible communications, sometimes including things like Zoom meetings. It's inaccessible environments. It's the fact that we are not heard, that our voices go unheard, and it is all about the many ways in which we are disabled by how society fails to accommodate people with impairments. And none of that is inevitable. But the upshot of that is we can't go where we want to go. We can't be with people we want to be with. Some disabled people have long been stuck in their houses. And in fact, there have been some positives, because having been told for decades, of course people can't work from home, that's impossible. Employment couldn't happen like that. Suddenly, oh yes, fine, everyone's doing it, and it becomes possible. Some people were saying, thank God everything's online now, because I can now participate in things I've never been able to participate in before. But by the same token, a whole load of new barriers became introduced. Digital exclusion. These sorts of things don't work for a lot of people. People don't have internet access. So barriers were changed, inequalities changed, they were supercharged in many ways. And certainly as CEO of Inclusion Scotland, we got to hear an awful lot about that. One of the first things that we did was to have a survey of disabled people. We had over 800 responses, which was massive. And other DPOs, as we're called, disabled people's organisations of disabled people, did similar. The results were so distressing that we had to bring in, and we seriously considered bringing in, eventually did bring in some sort of counselling support, free, so all our staff, many of whom are disabled people themselves, obviously, could get access, confidential access to support. Because what they were finding out, let alone their own situations, what they were finding out was so distressing. The first survey revealed a catastrophe in mental health. There were people who were saying they felt suicidal. There were people unable to access food, medicine. Obviously, health appointments went out the window. There were people who had children at school who were, and children with special educational needs who had no support. Unpaid carers were on their knees. People who never had to be unpaid carers before were suddenly finding, because the social care system had basically collapsed, that everything was being left to them. It was an absolute nightmare. However, in my role, I was able to kind of eventually, because initially government officials weren't talking to us particularly because they were so busy just responding. But when we did, we started to make a bit of headway. But of course, it isn't just government, it's also shops, it's other people. And the way that shops responded, suddenly people were able to get delivery slots who got delivery slots before, markings on floors that people with visual impairments couldn't see, so on and so forth. There's so much about the way, this is what we mean by the social model. A lot of that was inevitable. Didn't have to be like that, but that's what happened. So all this was going on. Meanwhile, as a disabled person myself, I was basically stuck indoors in my house. I have a garden, thank God. I was in it, or the house, for 15 months, going out 4 times for people to stick needles in my arm for one reason or another. I have never looked forward so much to having a blood test. I'm double vaccinated, but if I catch COVID now, I think I could still be at an extremely serious risk. I wasn't on the shielding group. I had to fight for it. I had to phone up my GPs. I don't tick boxes. I have lungs like old tea bags. I have multiple conditions, which would take my 4 minutes just to tell you what they are. But I had to persuade my GP. I had to fight. The receptionist tried to fob me off. Asked why I thought the GP could put me on the shielding list. I said, well, actually, it was the senior official in charge of the shielding program that told me they could. And in fact, that was the second biggest group of people on the shielding group. But they were people put on by their GPs. I also have to rely on support. Couldn't get my PAs vaccinated. They weren't in the system. Finally, by pulling every string that I could find, I managed to get that sorted out. But it was months later. It wasn't until about May. They should have been done in January.
Sorry to interrupt. I need you to wrap up. Thank you.
Yes, I will wrap up now.
Thank
So where I am now, more or less back where I was, fighting hard to sort of try and change the narrative, because every time politicians talk about lifting restrictions, I hear lifting protections. Anti-vaxxers are not freedom fighters. They're people who deprive me of my freedom. When I see people not wearing a mask, I see people who do not care about whether people like me live or die. And that's what we have to change. And I really hope everyone's going to work towards that. Thank you very much.
Thank you, Sally, for your speech. I think you make a really important point there. For me, it's like a lot of the suffering that people have experienced, it could have been, it was evitable. It didn't need to happen. So thank you very much.